Do you know that diagnosis of a concussion is difficult with a CT scan? A CT scan can detect only 1 out of 10 concussion patients. Traumatic brain injury is a common incident worldwide, an injury to the brain caused by an external force. Approximately 69 million people worldwide are estimated to suffer from TBI each year. Estimating the global incidence of TBI, TBI is classified as mild, moderate, or severe depending on the extent of the injury. Mild TBI is called concussion and accounts for 80% of all TBI. TBI is mostly diagnosed with a CT scan. However, a CT scan has several limitations. In the case of a CT scan, it can detect less than 10% of all concussions, with over 90% remaining undetectable. Additionally, excessive radiation exposure in the head causes a dramatic increase in cancer rates. Therefore, this is why patients should not undergo repeated CT scans, making it difficult to estimate prognosis. A CT scan takes much time to inspect due to long waiting times and requires a professional operator. A CT scan also leads to a space problem because of the equipment's size. These limitations of CT scans may result in concussion patients not receiving timely treatment, leading them to remain active, which can further exacerbate brain damage. As a result, approximately 10 to 20% of all concussion patients suffer from post-concussion syndrome. The accumulation of specific proteins in the brain produced by TBI can also increase the incidence of brain diseases like Alzheimer's disease. So it is imperative to develop new diagnostic solutions for concussions. When a traumatic brain injury occurs due to an external force, TBI-specific biomarkers such as GFAP and UCHL1 leak into the bloodstream due to damage to the blood-brain barrier. Ezdiatech has developed VEUPLEX TBI assay, a diagnostic kit that can quantitatively detect GFAP and UCHL1 in the blood for concussions. VEUPLEX TBI assay provides a high accuracy with 99.15% sensitivity and 98.91% NPV. VEUPLEX TBI assay is cost-effective compared to a CT scan. VEUPLEX TBI assay provides quantitative test results to determine the severity of traumatic brain injury for an accurate diagnosis. VEUPLEX TBI assay is convenient and safe to diagnose because it is diagnosed with the blood and does not require a professional operator. VEUPLEX TBI assay, simple diagnostic procedure. Step 1. Insert each test cartridge into the cartridge tray. Step 2. Add 50 microliter of test sample into the second well and 190 microliter of diluent buffer into the fourth well of the test cartridge. Step 3. Mount the cartridge tray with the test cartridge on the VEUPLEX analyzer. Step 4. Tap the start button to start the diagnosis automatically and provide quantitative diagnostic results in approximately 50 minutes. The cutoff values for GFAP and UCHL1 are 17 picogram per milliliter and 101 picogram per milliliter, and are diagnosed as positive if the level of either biomarker is equal to or higher than the cutoff value. VEUPLEX TBI assay provides quantitative test results to determine the severity of TBI for an accurate diagnosis. As a result, the most effective diagnostic solution for TBI is VEUPLEX TBI assay. Give concerns, take health. Ezdiatech.